Hello, my name is Sandro Graca, and I'm a licensed acupuncturist. I am a lecturer at the Northern College of Acupuncture in the UK, and I am a fellow of the ABORM, the American Board of Oriental Reproductive Medicine. So by now, I'm sure you've seen the other videos on the PCOS series, and if you haven't, I'm going to leave the link below so you can go and check them out. And just as a recap, we have the first one was the introduction, then we had the dietary advice, we had a lifestyle advice, we had vitamins and supplements, and the last one to be released was the acupressure advice. So then I thought, why not linking it back all the way to the very start with a very special episode where we will have the author of the book that I mentioned that I always recommend my patients to read, The 8 Steps to Reverse Your PCOS by my good friend and colleague Dr. Fiona McCulloch, and ask Fiona if she would just join us and just answer a few questions on, as we did before with the series, advice, tips, do's and don'ts on how to deal with your PCOS. So on the other side of the line, I have my good friend, colleague, and an inspiration for all the work that she does. And I want to start by asking Fiona, what would you say to a patient coming into your clinic saying that they've just been diagnosed with PCOS, and where should they start?
One of the first things that I would tell you to do is to find a really good support network, because this condition is a lifelong condition. It affects every element of your health and actually every element of your life as you go through all of the different stages. And it's just really great to have a supportive network. And one of my favorites is PCOS Challenge. They share a lot of information and they support research, and they actually help women with PCOS get together and learn about the condition. There's a lot of different types of PCOS and a lot of different presentations. And so it can be really confusing when you first are diagnosed to know where do you fit in. And you may not have the typical symptoms, or you might be at a different life stage. For example, what you would need as you're trying to get pregnant is very different than what you would need at perimenopause with PCOS. So finding other women to connect with is really invaluable.
One of the things that we were trying to achieve with this series was to give someone like a starting point. And sometimes, the starting point becomes Dr. Google, and you go online and it's like there's this mountain of information and you kind of lose that aspect of, where do I start?
The first thing that I would always say is really look at what stage are you at in your life, and how is PCOS affecting you? Because everyone is, as I said before, really different. So some women have a lot of what we would call insulin resistance, which means that they would have a lot more trouble with their metabolism. They would tend to gain weight around their midsection, have a lot of trouble losing weight despite doing things that work really well for everyone else. I just see a lot of these women working really, really hard to keep their metabolism healthy and not getting results. So if that's something that you're dealing with, and there's certain elements to focus on, and for women who have this as a central part of their PCOS, focusing on things like diet and exercise can be really, really powerful. For women who are maybe having irregular periods as more of a central part of the problem, they may or may not have the insulin resistance, but it would be looking at things like encouraging ovulation. So really figuring out, how is PCOS affecting you? Some women, they're dealing with a lot of the androgen excess symptoms, like hair growth in areas they don't want that, or hair loss from the scalp, or a lot of acne. And so just understanding those different elements of PCOS and how they're affecting you, that's a really good place to start, because I can't tell you how many times I've seen patients go on super restrictive diets and they're really not very insulin resistant, and that's really not going to help them too much. So I do always emphasize to figure out, what are the factors in your case that are really important for you. And you don't want to be just put into a bucket where, everybody receives the same treatment, everybody receives metformin, or that's just not going to work for everyone. So it's always about getting that individualized understanding of your PCOS for where you are at in your life.
And this is why I brought up the example of reading your book at the very first episode of this series, because it's a good step-by-step guide as well. And having that extra support of knowing that you're on the right track, because I deal more with people who are trying to get pregnant. This doesn't start and stop for those who are trying to get pregnant. It can be an issue, and most of the times it is, for those who then do get pregnant, and then later in life as well. So I really like calling it a metabolic condition, because this is lifestyle. This is good for your health. This is not just for a period of time. This is forever.
Yes. And the more that we learn about PCOS, the more we're seeing that it's actually something called a developmental endocrine condition, where the environment in utero when you're developing is contributing to your developing PCOS later in life. And so when you are pregnant, what you do during pregnancy will really influence the health of your baby going forward if you have PCOS. So if you implement those lifestyle changes, that'll make a really big difference. And then we know, it has been thought of as a fertility condition, which is totally incorrect. It's actually a condition of primarily androgen excess and metabolic dysfunction. And the metabolic dysfunction actually tends to get worse with age. And so a lot of patients, they just they have a baby and, they're like, okay, I'm done with PCOS, or they're not really offered any more help. But they actually need a lot more help to help them avoid developing things like diabetes or insulin resistance or fatty liver disease, cardiovascular disease. So these are all really serious chronic conditions that are in many cases quite preventable if you know that you have PCOS, and you can start, as soon as to implement many different lifestyle and diet changes into your life.
Sometimes because it's something that it's been there for a long time and it kind of became part of their lives, I always get that question that if I start doing something towards it, how do I know that it's working? What are the first things that I should be looking for that can say to me that this is working and encourage me to keep going?
Yeah, so with PCOS, I think it really depends on, if you are dealing with insulin resistance. I do always encourage patients to get some baseline lab testing done for markers like fasting insulin, HSCRP, which is a marker of inflammation. And we even do more detailed tests for insulin levels. But if you can get these tests done, you can actually see and monitor those improvements in your numbers. So that's always very encouraging. And along with that, you'll often see changes with insulin resistance. My favorite marker to look at is actually just waist circumference rather than weight. Weight can really vary. I mean, women with PCOS can gain muscle really easily. So say, for example, they're working out, they might gain muscle mass. So I don't really like to use that as a marker, but waist circumference has been found to be a very accurate marker of insulin resistance. So that's a great way to know if you're improving. If, for example, that's not, one of your issues with PCOS, and maybe, for example, you're having trouble with ovulation. Typically, women with this element are going to have long cycles from one period till the next. It'll be longer than around a month. So, 35 days or even longer. Seeing that cycle get a bit shorter is always a great sign of improvement. And that just tells us the ovulation is happening earlier. And so that's a really amazing thing to see happen because it's very noticeable for patients when they make changes and then they see, their cycles have gone from 45 days till 32 days, that's always super encouraging. So, and the other elements can be things like mental and emotional health. A lot of the time, patients don't know that PCOS is very, very, very much linked to anxiety, to depression, to eating disorders, and a whole variety of just different stress-related and mood-related conditions. And this is in part due to the neurobiology in PCOS, but also it's a stressful condition to have, to be dealing with androgen excess and all, weight gain despite working really hard against that. So seeing those improvements is always great. So if you're feeling happier, you're sleeping better, you're having, more positive thoughts. So those are great things to notice as well. I think it's really important to look at your overall health and, what are the areas in your life that PCOS is affecting, and sort of track those.
Yeah, it's so important to talk about the mental aspect of as well, because we're looking at the physical aspect and trying to look for those changes. But what about the mental aspect of dealing with that and sometimes being stuck and not knowing what else to do, right? Even in teenage years.
Yes, and I mean, I've heard stories of girls with PCOS being bullied, because of hair growth on their face, teenage girls, and it's just really stressful for teenagers to have this condition because it can affect your outward appearance and your feeling of femininity as you're going through puberty. So the stress starts really young while your brain is developing. And then, we also know there's actual biochemical reasons for this as well that happen in the brain, very much related to the way that the different feedback loops work with the hormones in the brain. So this is a really a condition that starts as it actually starts when in the womb, and then it presents more at adolescence, and it continues on through life. So it really does take a toll on patients, but there's a lot of hope. And if you really understand the condition and learn about your body as you go through each of the stages of your life, you can really thrive with this condition. It doesn't have to take your life in a negative direction. It can actually make you stronger in a lot of ways. Because it's such a complex condition, there's many different solutions that can work, and it's about finding the ones that work for you and your lifestyle. And a lot of PCOS involves things that are sort of feed back on each other. So like insulin resistance, for example. Say, for example, you eat a lot of sugar, or, say, for example, a lot of high glycemic index carbohydrates for a while, let's use, like, for example, French fries. And you eat that for a while, what's going to happen is your insulin will go up. You'll start to become more insulin resistant, and then it becomes easier to gain weight. So it's like the more that you do those types of things, the more you get into that pattern. But the reverse is also true. So anything that you do to make it better, you're reversing back out of that pattern too. So even if it's, a small change that you're making, even if it doesn't seem like a big thing right now, if you keep doing that for a length of time, you will see results. So it's just about consistency, finding habits and things that work for you, that you can maintain over a long time. And they really don't have to be super intense, or I even suggest against doing really restrictive diets, because these actually have been shown repeatedly not to work, especially for PCOS. They're stressful on the body. They're not something you can continue, and PCOS is something that you do need to find habits that you can continue, because it's a lifelong condition. And so it's a lot better to be moderate and consistent than it is to be super intense for a short period of time and then stop. So I would say watch out for that sort of thinking, and watch out for that kind of those restrictive types of diets. And instead, find a practitioner that you can talk to that can help understand your life and help you make those changes that really are going to make a difference for you, but also keep your life, happy and healthy, and make sure you still have all the things that you enjoy in a healthy way.
Fiona, thank you so much for doing this for us. Really, really appreciate it.
Thank you so much, Sandro. And thanks for everything you do for the PCOS community and all your hard work, because you've become a powerhouse and you've done so much good and helped share so much information.
Thank you so much. And for everyone, remember, there's more videos in this series. Please go back and check them out. I'll leave the link below. And just a very, very quick thank you again to Dr. Mike Armour for making this possible and coming up with this idea. Really, really appreciate it. And I hope to see you guys again soon. So till next time, be kind and be healthy.